and you definitely have control over what you eat. You definitely got control of what training you do, and you definitely got control of your positive adaptation days and your sleep. Focus on the things that you can feel in control of.
Welcome back to Science and Sports, episode number 52. Again, with me, Simon, as the host. And today I'm joined by Dr. Nicky Keay. Hi, Nicky.
Hi, Simon. Thanks for inviting me on.
Thank you so much for joining me today. You told me beforehand you're based in England and you are a doctor. Can you tell me a little bit more about that?
Sure. Yeah. I'm based in the UK. I was born in London, and I'm still in London.
Mhm.
But as a doctor, I have, traveled around a bit, not only within England, but also other countries. We were talking earlier, Geneva Hospital, I've worked there. Australia, I've worked there in sports medicine. So, yeah, I'm a medical doctor, but the reason as a youngster, I decided I wanted to study medicine was because I was doing a lot of sport myself. Tennis, competitive swimming. I was also doing ballet. And I was just fascinated. I wanted to understand for myself, why is it that if we do exercise, we all know that if we train and exercise, then we hope, why are we doing this? Because, of course, we enjoy it, but because we want to improve. And so I wanted to understand what that process looked like. And if we can understand what a process looks like, then we can also understand what might go wrong in that
Mhm.
process. So that was my initial motivation for. I wanted to find out more specifically about exercise, but of course, in order to be a doctor, you have to do all the training and all the subspecialities and everything. And then, as I was doing this, I realized that the area I really wanted to focus on was hormones, endocrinology.
Mhm.
Because whenever I said to somebody, "Oh, I'm really interested in doing sports medicine," they would say, "Oh, you want to do injuries?" I would say, "No, to me, that's kind of boring. I don't want to do that. The outcome, I want to know why." I mean, of course, accidents happen, and I know ice hockey, there's lots of collisions and accidents
Mhm.
like that, and you can't prevent that. But sometimes there maybe are some other types of injuries or illnesses or problems that athletes develop, which actually, if we could understand why, we could prevent them in the first place. So, in my quest to find out which area of medicine I needed to look at, particularly, I began to realize that it was hormones. Because going back to my original question, what is it about exercise that helps us be healthier and improve our performance? And it's the hormones. Hormones drive positive adaptations. So, starting off, as I say, from studying medicine and then becoming a qualified doctor and then getting more experience, like we said, around the world, looking at what's happening around the world. And now I'm in the fortunate position that I've, done all this really interesting stuff and lots of research along the way. And now I continue to do research, and also I give advice to athletes and dancers who are struggling or want to find the way they can optimize their performance.
Mhm. Thank you for the brief introduction explanation. You just mentioned endocrinology. I hope I pronounced it correctly.
Yes.
Can you maybe tell me and also my German listeners who are maybe joining in what that really means? So um, you analyze the hormones and in comparison with the exercise, how that develops?
Yeah. So, uh, endocrinology is the study of hormones because officially
Mhm.
it's the endocrine system, which means all the glands producing the hormones and etc. Everything.
Mhm.
Because it's like a team, right? It's not
Mhm.
just one hormone. And they all act together as a team, doing slightly different things, but also communicating with each other. So exactly like an ice hockey team, I hope, communicating, or they're all going for the same objective, really, to make this
Ideally,
person as
yes.
healthy as possible. So it's kind of
Yeah.
like that. That's what the hormones are. And you might be thinking, well, this all sounds very vague and theoretical, but what exactly does a hormone do? A hormone is a chemical messenger that travels around in the bloodstream. Great way of getting about. You can get to every cell in the body. And then when the hormone arrives at a cell, it directs the expression of DNA. And DNA, as we all know, is the blueprint for life. So, for example, you go and do your training, and then it's when you get fitter actually while you're resting. Then after the training, that a message will be sent, like growth hormone, to all the cells, and they will tell the nucleus, the DNA, please make some more muscle protein. Okay, so the hormones respond to what we do. So if you sit around and you don't do any exercise and you eat a lot of food, then the hormones will, like, they haven't got much work to do in that sense, just trying to control your blood sugar. But if you are an athlete and doing training, then you put in the stimulus of the training and hopefully you fuel appropriately, and then the hormones will respond to that stimulus and will drive positive adaptations to help you become not only healthier but hopefully fitter in the long term. So you can see that's why I wanted to study hormones, to understand that interaction between what we do, the hormones, and the outcome. And if you're not, as an athlete, getting the outcome you hope for, then we have to look back to what the athlete's doing. Maybe there isn't a good balance or the optimal balance between the training and the nutrition. So then we go back and look at the inputs and try and adjust those to make sure, or hopefully support, the hormones that would drive the positive adaptations you're looking for.
Is it just about nutrition, or is it also the recovery aspect, sleeping, and all those other factors? Does it also?
Absolutely. Yeah. I mean, I quote Hippocrates, not a recent research paper. 2,000 years ago, Hippocrates said if we could give every individual just the right amount of nourishment, just the right amount of exercise, not too little, not too much, we would have found the surest way to health. 2,000 years ago, he didn't realize that in between the inputs and the output, that's the hormones acting. So you're absolutely right. It's not just nutrition, it's not just training, it's the combination of all these things. So, what are you eating? When are you eating it? What training are you doing? When are you doing the training? And you mentioned something really important: sleep and recovery. Sleep is the chief nourisher in life's great feast. That wasn't Hippocrates, that's Shakespeare. Anyway, so when you actually get fitter when you're asleep, because lots of athletes don't realize this, they think, oh, in order to get fitter, I need to train like crazy all the time, no rest days. No, no, no. But actually, if you do that, you won't reap the benefits of doing that, because the hormones take some time. You can imagine the hormones take time to go into the cell, for the cell to make some more muscle protein, etc. It takes some time. And it's only got the time and the opportunity to do that when you're resting or when you're asleep, particularly. The two main stimuli for growth hormone release, very important for muscles, is exercise, of course, but also sleep. So that you're very make a really good point, Simon, that we have to put sleep and recovery in there. And the athletes don't like that word rest day. I know. I don't either. It's like, ooh, that sounds horrible, really negative. Like I'm
Mhm.
lazy, I'm not doing anything. So I'm renaming a rest day. I'm calling it positive adaptation day. It's a
Mhm.
positive thing to be sensible and have at least one rest day per week, because that's actually the positive adaptation day when you're going to get fitter. So it's the combination of all those three things. But also, you're right, there are other things in life going on. It's overall sort of stress load, if you want to call it that. I mean, the
Mhm.
official medical term is allostatic load, which means all the stress factors put together. So other things that are happening, having arguments at work, or relationship problems, lots of other
Yeah.
things could feed into this, but you can only control what you can control. You know what I mean? And you definitely have control over what you eat. You definitely got control of what training you do, and you definitely got control of your positive adaptation days and your sleep. So,
Mhm.
focus on the things that you can feel in control of.
Is there one thing that outweighs the other in terms of how fast you can back to your like optimal performance then?
So the sort of example, so this is the recipe for hopefully optimal health and performance. If you get
Yeah.
those three factors in the right range, all of them at the right time, you're good. But if there's too much of one or the other, or often they go in combinations. So, for example, an athlete who is doing probably overtraining without any recovery days,
Mhm.
and maybe also not fueling sufficiently, this is a bad balance. Well, it's not a balance. And so the person can end up with what we call relative energy deficiency in sport, REDS.
Mm-hmm.
And so although that word makes it sound like it's all about the food, actually it's the food and the training, because lots of training puts a stress on the body in its own right. But also, if you're doing a lot of training, guess what? You've got a really high energy demand. So it's difficult to meet that energy demand. So you're right, we can't really exactly. So your question, which one is the most important? I'm afraid I'm going to say all three of them have equal importance. And it's about
Right.
getting the right balance of all of them, which is sometimes a challenge, I have to admit. But that's my job, and that's why I love my job, because, I help the athlete look and see maybe they didn't realize that, for example, this positive adaptation, this rest day is vital, and maybe they didn't realize that they need to do all training in a fueled up state with carbohydrate. So that's my job, to try and see where maybe they have got a little bit out of balance.
Mm-hmm. You just mentioned REDS, um, relative energy deficiency in sports.
Yes.
If I'm correct. What are some we talked about if nutrition is not right, if the sleep
Mm,
is not right, if you train too much.
mm-mm,
What are some symptoms or signs you can see on people
mhm.
or symptoms of REDS,
Yes.
what you can look out for?
Mm. Well, it's a tricky one because it sort of creeps up gradually. You won't wake up one day and get all these symptoms and
Right.
say, "Oh, I've got Reds." And so
Right.
this is why it makes it very tricky. So it will creep up on you gradually. It will creep up in the terms that you might start to feel tireder than you would expect.
Mhm.
Difficulty sleeping, interesting, because your body's trying to keep you awake to make you go and look for food, right? So you're feeling a little bit tired, you're not sleeping so well. Of course, you might get some injuries, more injuries than you would expect, and
Mhm.
outside of traumatic injuries. Soft tissue injuries, bone stress injuries in particular are a warning sign. For female athletes, one of the top ones, the sort of severe primary indicator of REDS from the IOC consensus statement, is that their periods stop. So the menstrual cycle stops, because if you stop your menstrual cycle, it's a very good way, the body knows this is a good way of conserving reserves, saving on energy. So if an athlete's her periods stop, and especially if they stop for a long time, then this is actually quite, it's a big warning sign.
Mhm.
For male athletes, the equivalent is that their testosterone goes lower, right? So they're going to feel fatigue, they're going to have low libido, that's the equivalent for men. So these and some other things, sometimes athletes have digestive problems because they're not giving
Mhm.
enough energy for the digestive system to work. So there are a lot of potential symptoms there that could be warning signs. And my job is to uh, identify that this is red. After all, it could be a true medical condition, if I can put it like that.
Mhm.
It could be that athlete's got glandular fever, for example, and that's why they're
Yeah.
feeling so tired. It could be that one of the hormones has gone wrong, if I can put it like that. So my job is to do some blood tests and determine that there's not a medical reason, but from the blood test, I can also get particular information to confirm my suspicion of Reds. And so I'm going to look at those blood tests, and there's some blood tests. I don't know how technical we want to get, but some of them are primary indicators of Reds from the IOC consensus statement, and I can confirm that for a female athlete, her periods have stopped because the whole system has shut down. And another thing I want to mention, Simon, if I can, is for your listeners that thinking, well, how would I know? Like you say, how do I know? And so one of the things we've done just recently, we've made a free, I want to stress that point, free online questionnaire you can do. It's called the Peak Personal Energy Availability, right?
Mhm.
Questionnaire. And it's based on our research. So it's, validated. We've used this questionnaire with in our research with athletes, matched it up against their blood tests, etc., and their bone health. So we're pretty confident that these are very insightful questions that we're asking you. Not too many, about 15, and you just click through, give your answers, and then at the end of that, it will generate immediately a report, and it will give you a score, whether you're it will either say, hopefully it will say, it looks like you're good. You haven't
Mhm.
got reds and you've got everything in good balance. Or if it, it might say, well, it looks a little bit, maybe there's some improvements you can make, or it might even say, I think you've definitely got reds and so you need to seek help. So that's a good starting point for people. You can do it, and it's all your information. You download the report yourself, and it's up to you to decide what you do with that information. You can come and have
Mhm.
a chat with me, of course. But if you wanted to show it to your coach or your own doctor or whoever, then it gives you a little bit of an insight.
Yeah.
And it's split down. The score is subdivided into physical things. So those, like injuries, etc. It's also split. It's got a category for physiological things. So if your periods are stopped with a female athlete, for example, and then psychological things, because psychology plays a big part in this. So if the athlete says they're feeling really stressed about their shape, their weight, what they're eating, these are indicators that the athlete might be at risk.
Mhm.
If you, from what I've said, you might be thinking now, well, why would an athlete almost intentionally sabotage their own performance?
Yeah.
If these are the key things, well, then why would an athlete eat less, train crazy, not have rest? That doesn't kind of make much sense. But an athlete that gets reds, or any athlete, I think, is going to have certain psychological characteristics. They're going to be really determined. They're going to be a little bit perfectionist, right? They're
Mhm.
going to be driven, motivated. These are great things. And if you use those in a flexible way, then you will it absolutely reach your potential, right? But
Yeah.
if you use these things very rigidly, it's like, I'm not going to eat this. I'm going to train like crazy. I'm not going to have a rest day. If you use it in the sort of a negative way, then this is why you might get red. So the psychological aspect of this is really important. And the person will only sort of realize and recognize and be able to adjust if they sort of accept that. I don't want to change people's personalities,
Yeah.
but to make them realize that these things, they need to direct them in a more positive way rather than this very rigid negative way.
Are those questions primarily for athletes, or can also like
Mm,
semi-professional athletes or
absolutely.
non-athletes also do it?
Yeah, that's a really good point, Simon. I mean, lots of people, when we say reds, they assume this is just elite athletes in
Mhm.
full-time training, but absolutely it's not. Well, number one, I mentioned dancing because I work with dancers. I'm the medical advisor to Scottish Ballet, and dancing, or ballet particularly, it's not a sport, but definitely they can be affected. But I think that it's more likely it's the amateur athlete, not even competing, but the person that is, wants to do a lot of exercise, wants to be fit, and they've got a full-time job. They're trying to do so many things. These people can also end up, with reds, because
Mhm.
if they're working really hard, they're training really hard. Guess what? That this is their personality. They are that type that's going to really, really push everything. And so that's a really important point you make. It's not just elite athletes, and it's not just restricted just to athletes. It's anyone that's exercising too much, maybe, and a little bit
Yeah.
too rigid with their eating behaviors, and also any age. I mean, it can happen quite frequently in the teenage athletes, because they're sensitive, their body's changing, they're going through puberty. But also, it can happen in older people. Just saying, for older people, women going through perimenopause, masters athletes, they're frustrated, their hormones have changed, they don't like it that they don't look like they did when they were 21, and they can't, perform so well, and so they think they're being weak and they need to train more, they need to restrict more. So it can happen to anybody, literally.
Ever wondered what really happens to your food when you cook it? Trackpad helps you see how nutrients change, compare your favorite meals, and track polyphenols at a glance. It's like nutrition tracking, but smarter. It's interesting that you just started talking about older athletes or masters
Mm.
athletes, because my next question was
Ah,
about the change of or if there is a change, I
Mm,
put it this way, of hormone health the older you get, and as the athletes age, does that occur? What can you share? What happens and why it
mm,
happens?
mm. I mean, men get old as well. So men and women we're talking about here.
Yeah.
From the age of, particularly from the age of 50 onwards, I mentioned this hormone already, growth hormone, the
Hmm.
anabolic hormone that builds muscle and bone. For men and women, that starts to decline. So that's already a challenge. And if you do nothing, and you just keep doing what you've been doing before, it won't have such a positive effect on your health and your performance because the hormone that's driving the adaptation is lower in itself. So you have to
Hmm.
be smart and adapt what you're doing. In other words, you have to focus more on quality of training than quantity, and you
Hmm.
need to do more strength work, and you even need to eat more protein. These are the top tips
Okay.
for men and women in this age group, because I have lots of athletes that come to me who are 50 and they say, "Oh, I don't understand what's happening. I'm doing all the same things I did when I was 21, but I'm not having the same results." It's like, because you're not 21 anymore and your hormones have changed. So you
Hmm.
have to respect the change. You can't change, that's how it is. But you have to be smart about it and anticipate this change and change slightly your training and your eating behaviors. For women, there's an extra thing, of course. We have something called the menopause. So here, this is when the ovaries retire and they stop producing estrogen and progesterone. Estrogen is a very powerful anabolic hormone as well. So women, we have a double whammy. We have lower levels of the growth hormone, the anabolic hormone, but also quite a dramatic drop in estrogen. What about men? Their testosterone goes down a little bit, but not like a big drop for women. So yeah, I would argue as women we have it a little bit tougher, but that's fine. We're up to the challenge, so we have to be even smarter
Hmm.
about the things I said, making those changes. And for women, there is now the possibility of HRT, hormone replacement therapy, so some estrogen and progesterone, which helps with symptoms because lots of women say, they just feel really tired. And so it's affecting their quality of life. And they don't actually even have the energy to go and exercise, even if they wanted to. So
Yeah.
HRT can help their quality of life, make them feel better so they can work better and also, do their training, etc. So it's a combination. So it goes back to the thing that Hippocrates said. We need to review the training, the nutrition, and we're going to add in, of course, the sleep and the recovery. As your hormones change, you have to respect that and make slight changes to what you're doing.
You just had the example the of someone who does the same
Mm,
now when he or she was 21.
yep.
Is it still, maybe it's a dumb question, but is it still something positive to do, or is working out the same as, let's say, 30, 40 years ago when you were a teenager? Then also, has it a negative impact on your health and like hormone system?
Well, yeah, that's a good point because my mother's generation, she was very active. She used to cycle to work and she used to do flamenco dancing anyway, but it wasn't really a thing that you
Hmm.
would train. Do you know what I mean? As such, you would just be active. So that's a really important point that now we have a generation of young athletes, and actually to a certain extent, even though I'm old now, when I was young, it was more acceptable to do training, like competitive swimming training every morning. So that's a good point. And but it's the same thing. The whole theme is that you've got to be careful about not overdoing it. So the young athletes, absolutely, we want them to enjoy their exercise, their training, for them to get inspired. But we don't want them to try and train like an athlete. So you've got to train appropriate for your age, or more precisely, you've got to train appropriate for your hormones.
Hmm.
So a young teenager whose hormones are changing and they've got a big energy demand because they're finishing puberty, they're still growing, they've got your brain takes 20% of your energy intake, they've got studying. So they are not equipped to train like an adult yet because
Hmm.
they can't, the system can't cope with that, right? And in a similar way, When we get older, the hormones have now changed. We've now got a different pattern. So we have to reflect and say, okay, maybe I was able to train like a lot in my 20s and 30s, but now I just have to be smart about my training, about my nutrition. You have to change it. But I think your point is, for a 50-year-old today, what did they do in the past? What were they doing when they were a teenager and 20-year-old? And that probably does come into the equation, because if they had REDs, for example, when they were younger, hopefully they've overcome that and they've improved their bone health and they've improved things. But obviously, if it was still lingering there all along,
Hmm.
then yeah, it's going to be even harder, when as they get older. So I think the point is we have to train according to our hormones, our age, our biological age. I'll put it.
Yeah,
We have to train appropriate for our biological age, and also we have to be mindful of maybe what's happened in the past. You're right.
yeah. Is there any like story anecdote about the impact of hormone health that you can share with us without reaching any confidentially
Mm.
informations or something like that?
Well, I mean, I see it all the time. I see it more and more in the younger generation, in the teenagers, the aspiring athletes, aspiring dancers.
Hmm.
They want to break world records. They want to be the lead dancer in the ballet company. Great, brilliant, by the way. But because they want to, achieve even more than their parents or their grandparents, I have an amusing slide of my grandmother and me,
Hmm.
side by side, both of us in our 20s. And if you just look even within our family, you can see there's been a big change, improvement in ballet. So I think that that would be my example that I see very frequently. The young athlete wanting to achieve big things, but like we said, they've got all these other demands, and so they do slip into a combination of overtraining, reds. They intertwine. And so if it's a female athlete or dancer, then often, their periods have stopped and they starting to get some injuries, but maybe not something too major. But then they continue to training, increase their training load even more now into their late teens and early 20s. And this is when the stress fracture happens,
Hmm.
because the bones have not been able to mature fully. And now they're going to try and train even more. And then that's really sad when they get to that point, because then it is reversible, but it's actually going to be now more of a challenge for them, not least psychologically, because they've got to, you know, improve their nutrition, decrease their training load. They've got to try and improve their bone health, and that's a really tricky process. And that sometimes, frankly, it's not achievable, or they continue to struggle. So, that's the sort of scenario I often see with the young athletes.
Hmm. If I put you into a mentor role now for, let's say, up and coming young sports scientists or even um, more experienced sports scientists, and you had to give them, let's say, three tips for working with athletes and hormone health, what would that be? What would you tell them? This podcast is presented by Like Me, your partner for social media and online marketing from Weiden, and Praxis im Salzhaus, your contact for physiotherapy and health in Altenstadt.
I think the most important thing is to listen to the athlete. That's sort of a rule for doctors as well, or not a recommendation for doctors, because I think sometimes we can get carried away with research papers and all this sort of thing. But ultimately, this is why I love being a doctor,
Mhm.
because I'm dealing with people. So I have all the theory in my head, it's true. But ultimately, I need to understand the athlete, because like we said at the very beginning, it doesn't make any sense. Why would you end up in reds if you you know.
Mhm.
But that's when you have to understand and listen to the individual. What is the driving force behind that, the psychology of it, and then try and give practical advice. That's the other thing, practical. There's no point saying, "Oh, you've got to eat like, all this carbohydrate, and you can only do strength training," because I know that will just be, they won't do it at all.
Mhm.
So it's a plan. It's like, this is where we're trying to get to, but we're going to do it in these steps. Are you
Yeah,
happy with that? Yeah, yeah, I can do that. I was like, actually, now that's going to be really difficult. So I think it's, listen to the individual you're working with, try and understand their motivations, and try and work with them in a practical way to make that happen. Yeah, so that's my best advice.
that's
Absolutely
also
absolutely understand all the theory, read the papers. Please do. You need that, but then ultimately you've got to, how are you going to put that into practice?
yeah, that's also part of the book you wrote, probably,
Oh
right?
yes, yeah, yeah. Yeah, so I wrote a book called Hormones, Health and Human Potential, because it goes in that
Mhm.
order. Now you can see hormones, then you're
Mhm.
healthy, and then you can perform. You reach your full potential. And so it's a book that's written for everybody. It's not medical doctors.
Mhm.
But having said that, it's got a little bit of a story in it, right? Because I mentioned I do ballet, so I've written it in acts and scenes, and it's sort of a little bit of a story. And the second act is going through the different life stages, and what's happening with the hormones, like we discussed, and what are the top tips to being at your best at those points. So the reason I wrote that book was because I wanted to share what I have learnt. And so I've put it in a nice story way that hopefully people can understand, but also in a quote serious way, if I could put it like that. So it has got references. It's based on obviously evidence, information, and I put in some diagrams which I thought would help illustrate what's going on. So hopefully that will be a useful resource for everybody, whether you're reading it as an athlete, whether you're reading it as you said, a scientist, a healthcare professional. Hopefully that will help help you make sense of what's going on.
Yeah. Is it okay if I put the link to the book and also to the
Pete,
questions
please
where you
do, please do, please do. Yes,
yeah, where you told me in the beginning, also in the description below.
yes.
Um so to to wrap it up,
Hmm.
it's important to also reflect on your own hormone system, on your own hormone health, and not only on training metrics, and to
Hmm.
see the whole picture for optimal health, longevity, performance. Am I correct with what what I'm saying?
Yes, and also I think we can get very carried away with all these, as you say, these training metrics. I've lost
Mhm.
count of how many monitoring things there are now.
Yeah.
You can measure, I don't know how many things, which, yeah, of course, I understand some of those are useful, like for a cyclist, my family, they're all cyclists, they've got power meters. I understand that's useful to know that.
Mhm.
And so I'm not saying don't record these things. And for women, I think tracking your cycle, checking that you have got a regular cycle, but don't get overwhelmed with all this data, because ultimately the person that knows your body best is you.
Yeah.
So also, how are you feeling? You wake up in the morning, how are you feeling? You can corroborate that with, HRV, heart rate variability, if you wish. But actually, I think sometimes we've sort of lost sight of the basic fact that
Mhm.
you can monitor yourself,
Yeah.
and reflect how you're feeling. And also, if you wake up and you're not feeling so great, and maybe your heart rate variability is low or something or whatever, then it's like it makes you reflect. It's like, oh, I know, it's because yesterday I didn't fuel properly after my training session or something. You can make the connections
Mhm.
with how you're feeling, any metrics, and what's happening, because then you'll understand more and more about your own body. So I think it's about, as you say, personalizing it for you and not
Mhm.
getting too bamboozled with all this information, and also not too bamboozled with incorrect information.
Yeah.
I mean, unfortunately, this is a great podcast. I know you give good information, but as we know, there are some things on social media which aren't founded in facts, and we can get misdirected. So I
Yeah.
think just being confident and collecting the information, the useful information for you, that's really the important thing.
Yeah, and to be honest and really
Yep.
listen to your body and
Exactly.
don't play it down, because it really is about your health and you only have certain amount of time
Yes,
and you don't
exactly. You want
want.
to get them well, you want to reach your full potential, don't you? You
Yeah,
see?
exactly.
And so you don't want to, take well, shortcuts don't work, unfortunately. There is no
Yeah,
such thing as a shortcut. So like we said, positive adaptation days, these are not negative things. These are important not to overdo it, right?
yeah.
Okay.
Okay, everyone, please look into Nicky's book. Check out the questions in the description below, and also I'll link the website of yours also in the description. And yeah, for me, there's only one thing to say. Thank you very, very much. It was a pleasure talking to you. I learned a lot about hormones. I learned a lot about medicine. So that's a nice little refresher, and also a lot of insights and informations that I can really use in my personal life and also adapt to my athletes. So thank you very much.
Thanks, Simon. My pleasure.
I wish you all the best, and I hope we talk again in the future again.
Sure. Thanks.
Thank you. Bye bye.
Bye.
Thanks for listening to the show. If you enjoyed this episode, make sure to follow the podcast, leave a rating or comment, and share it with someone who loves sports science. And for more content, follow me on Instagram at science_in_sports_. See you in the next episode.